Gametogenesis. Basics. Primordial germ cells, PGC. What does it mean? They are pluripotent cell, gives origin to male and female gametes, produced by cells of apiplast during second week, migrates to yolk sac by fourth week, migrates to genital ridge gonads by fifth week. Here are the green color are the PGCs. Primordial germ cells, pluripotent in nature. Note, pre-embryonic period is 0 to 2nd week, embryonic period is 3rd to 8th week, fetal period is 9 week to birth. So pre-embryonic period is 0 to 2nd week, embryonic period is 3rd to 8th week, and fetal period is 9th week to birth. Type of cell, pluripotent cell. They have the ability to form all germ layers. Example, primordial germ cells. Totipotent cells, ability to form entire embryo and extra embryonic tissue. Example, every cell up to 8 cell stage is totipotent. Multipotent cell, ability to form more than one category of, at least 2 category of cells. For example, hematopoietic stem cells. Oligopotent cells can only form one category of cells. For example, vascular stem cells. Applied aspect, craniopharyngeal teratoma due to abnormal migration of PGC, that is primordial germ cells, to neck, that is craniopharyngeal teratoma. Sacrococcygeal teratoma causes abnormal migration of primordial germ cells to sacrum and coccyx, persistence of primitive streak. Mitosis versus meiosis. Mitosis, type of division, parent cell 46 chromosome, equitional division, daughter cell 46 chromosome, daughter cell 46 chromosome, 2 daughter cells. Meiosis, parent cell 46 chromosome, reduction division, daughter cell 23 chromosomes, daughter cell 23 chromosomes. Mitosis occurs in body cells, meiosis occurs in germ cells. Crossing over is not present in mitosis. Daughter cells resemble parent cells. Crossing over present in meiosis, exchange of chromosome material. Daughter cells do not resemble parent cells. Age at occurrence. Female occurs at intrauterine life, male after puberty. Very important. Female intrauterine life, male after puberty. Oogenesis. Primordial germ cells reaches ovary by 5th week, called oogonium. Mitosis, all oogonia become primary oocytes by 5th to 7th month. Enters meiosis 1, completes prophase, enters resting diplotin phase and remains there until puberty. So they enter resting phase, diplotin phase, and remains there until puberty. After puberty, primary oocyte. Meiosis 1 resumes. Secondary oocytes and first polar body. Secondary oocytes, they enter meiosis 2, completes prophase and metaphase, arrested in metaphase for 24 hours. Ovulation, Graafian follicle ruptures to release secondary oocyte. So they are arrested in diplotin resting phase until puberty, and then they are arrested in metaphase for 24 hours. Then Graafian follicle ruptures to release secondary oocyte. Sperm entry within 24 hours of metaphase arrest. If present, secondary oocyte will complete meiosis too and create an ovum and second polar body. Ovum and sperm will undergo fertilization to form a zygote, fertilized egg. If sperm entry not present, then corpus luteum formed from the ruptured Graafian follicle persists for 14 days, shrinks to form white scar, corpus albicans. First polar body. Polar body, cells without cytoplasm due to unequal division of cytoplasm. Primordial germ cell reaches testis, enters dormant phase until puberty. After puberty, primordial germ cells, also known as spermatogonium, mitosis, 5 to 7 cycles of division, primary spermatocyte, undergoes meiosis 1, makes secondary spermatocytes. Undergoes meiosis 2, makes spermatid. Spermiogenesis, rearrangements of organelles. Then it makes spermatozoa. Site of meiosis in males, seminiferous tubules. Seminiferous tubules. Site of maturation of sperm, epididymis. Site of maturation of sperms, epididymis. Site of capacitation, conditioning of sperm, female genital tract in 6 to 8 hours. Site of meiosis, seminiferous tubules. Site of maturation of sperm, epididymis. Site of capacitation, conditioning of sperm, female genital tract, 6 to 8 hours. Difference between spermatogenesis and oogenesis. So spermatogenesis begins at puberty, while oogenesis begins in intrauterine life. Polar body formation is absent in spermatogenesis and is present in oogenesis. Gametes formed first primary spermatocyte creates 4 spermatids. One primary oocyte creates 1 ovum. High yield point. Spermatogenesis completed in 74 days, more commonly than 64 days, followed by 60 days. So 74 days. Secondary oocyte in metaphase arrest for 24 hours. Viability of sperm in female genital tract for 48 hours. Most fertile period is 2 days before ovulation till 1 day after ovulation. Most fertile period is 2 days before ovulation and 1 day after ovulation. Indicators of ovulation. LH surge occurs 36 hours before ovulation. LH surge occurs 36 hours before ovulation. LH peak occurs 12 hours before ovulation at the time of ovulation. First and second week of development. First week of development stages. Day 1. Fertilization in the ampulla. 12 to 24 hours of ovulation forms zygote. Day 1, 2 cells to 4 cells. Day 3, 8 cells to 16 cells. Morula is called at 16 cell stage, more than 8 cell stage. Day 4, 32 cells advanced morula, which will enter the uterine cavity. Then uterine fluid enters advanced morula, forms day 4 to 5 blastocyst. Day 6 to 7 implantation. So I would like to remember this. Day 6 to 7, that is 1 week, is the time of implantation. Blastocyst is implanted in the endometrium, ends by day 10 to 11. Bleeding due to erosion of endometrium, Hartmann's sign. Here is the blastocyst, which comes after the 16. It comes after the advanced morula enters the uterine cavity and the uterine fluid enters the morula. It becomes a blastocyst like this. So here, this is the embryoblast, which has the inner cell mass and it forms the embryoblast, and this is the trophoblast. It is the outer cell mass and it forms the placenta. Zona pellucida prevents implantation and polyspermy. Disappears by day 5. Blastocele is the cavity. Ultrasound, endometrial cavity, decidua. Endometrium in pregnancy is called decidua. Gestational sac, blastocyst, intraresidual sign. Implanted in deep layer of decidua. Second week of development. This was the first week, now second week. Blastocyst is now 38 cells separated by extra embryonic mesoderm. Trophoblast 53 cells, embryoblast 5 cells. Trophoblast is again syncytial layer and cytolayer. Embryoblast 5 cells is epiblast and hypoblast. So blastocyst 58 cells, out of that 53 cells are for trophoblast, which are again syncytial layer and cytolayer, while epiblast is 5 cells, which are epiblast and hypoblast. Cells, embryoblast. This is the epiblast on the top and hypoblast at the bottom. This is the amniotic cavity. This is primary yolk sac. Epiblast is on the dorsal side and hypoblast cuboidal cell is on the ventral side. Exocoelomic membrane squamous cell. Exocoelomic membrane squamous cell. Double bubble, double bleb sign. Double bubble, double bleb sign. Due to amniotic cavity and primary yolk sac. So this is the amniotic cavity and this is the primary yolk sac. Trophoblast. Lacunae filled with blood. Blood diffuses into embryoblast. Uteroplacental circulation established by day 15. Cytotrophoblast, well-defined cell membrane. Syncytiotropoblast, cell wall absent, multinucleated, produce hormones in pregnancy, erodes endometrial glands and vessel. So this is the cytotrophoblast, where the cells have a well-defined cell membrane, and this is the syncytotrophoblast, where the cell membrane is absent. It is simply multinucleated. It creates hormone while the patient is pregnant, and they slowly erode endometrial glands and vessels. Here we have, this is the purple color is the cytotrophoblast. The behind that is syncytotrophoblast. This cavity is amnion. This is epiblast. Epiblast is dorsal and hypoblast is ventral. So this is dorsal and ventral hypoblast. And here is the blastocyst cavity. Here there is a formation of Husser's membrane, uterine cavity. Extraembryonic mesoderm. Somatopleuric layer, outer layers of amniotic cavity. Start from the inside. So they are showing extra embryonic mesoderm. This is the amniotic cavity. This is epiblast. This is hypoblast. Secondary yolk sac, smaller, surrounded by extraembryonic mesoderm derived from primary yolk sac, more than hypoblast and epiblast. So basically everyone is contributing some cells and they are creating this mesoderm, which is called extraembryonic mesoderm. So maximum cells are coming from primary yolk sac and other cells are coming from hypoblast. Outside of that is this cavity, and here is undivided part of extra embryonic mesoderm, undivided part. Cavity is not formed, and outside of that is somatopleuric layer, outside layers of amniotic cavity. So how is extra embryonic mesoderm form, which is this layer? Everyone contributes cells to that mesoderm. HCG produced by syncytotrophoblast functions, stimulates production of progesterone, essential to maintain pregnancy. SC. Sample maternal blood by 8th day, maternal urine by 9th or 10th day, or first day of missed period. So HCG is present in the blood as early as 8th day of the mom, or in the urine by 9th or 10th day, or first day of missed period. Doubling. It's doubled in normal intrauterine pregnancy every 48 hours. It's doubled. Ectopic pregnancy, doubling is it's present, but it doesn't double. Critical value 2000 international units. Normal intrauterine pregnancy, gestational sac visible. Ectopic pregnancy, gestational sac absent. The critical value is 2000 international units of HCG for being pregnant. In normal intrauterine pregnancy, you will see the gestational sac. In ectopic, it would be absent, but the HCG will be about 2000. Third week of development. Events in third week. Gastrulation. Formation of germ cell is called gastrulations. Neurulation. Formation of neural tube is called neurulation. So here we have epiblast, columnar cells. Tail end of the embryo is called primitive streak, formed by proliferation of epiblast. Third week of development. What happens? Gastrulation is the formation of different germ layers, and neurulation is the formation of neural tube is happening in the third week. Now here the epiblast are proliferating in the end, that is the tail end of the embryo, columnar cells, and that is called primitive streak, formed by proliferations of epiblast, and they are formed at end of 2 weeks, so 14th or 15th day. An indication in then what it indicates beginning of gastrulation. Below that is hypoblast, cuboidal cells, and here there are some long cells which are called procaudal plate, indicates future head end. Columnar hypoblast cells. So the hypoblasts are cuboidal cells, but the head end becomes columnar, and that is called precaudal plate, and it forms orobucopharyngeal membrane. It ruptures and forms oral cavity. Precaudal plate. This is the developing notochord. Primitive, after the primitive streak we have now primitive knot, and we have cloacal membrane. Gastrulation. Formation of germ layers occurs in third week in craniocaudal sequence. Craniocaudal sequence. All germ layers are derived from epiblast. All germ layers are derived from epiblast. Primitive streak, epiblast. The cells are migrating into the mesoderm as they have shown here. These are amnioblast. These are hypoblast being displaced laterally. So in between in endoderm is gathering. Very important fact to remember, all germ layers are derived from epiblast. So here you can see the hypoblast is being displaced laterally, and the epiblast is migrating to form endoderm and also in the mesoderm. Now formation of germ layers. 3 germ layers: endoderm, mesoderm and ectoderm. Endoderm. Primary or the first germ layer to be formed is endoderm. The first germ layer to be formed is endoderm. Develops from epiblast. All germ layers are formed from epiblast and replaces all hypoblast. So endoderm will come from the epiblast and replace all the hypoblast, and it is the first germ layer to be formed. Mesoderm, second germ layer to be formed, develops from primitive streak, epiblast. So the primitive streak, if you remember, was the proliferation of the epiblast on the tail end of the embryo. So now they are migrating in between and forming the mesoderm, and it is the second germ layer to be formed. Ectoderm, it is the last germ layer to be formed, and it develops from the remains of the epiblast. So it is the last germ layer to be formed and develops from the remains of the epiblast. So very beautifully they have explained that all germ layers are formed from the epiblast. So first the epiblastal cells will migrate, replace all the hypoblast cells and form the endoderm. Following that, the primitive streak, the caudal proliferation of epiblast cell will migrate in between the layers and form the mesoderm, and the remaining epiblast cell will form the ectoderm. So now mesoderm, here they have divided it into lateral mesoderm, intermediate mesoderm, and paraaxial mesoderm. And here they have shown the notochord. Notochord is midline mesoderm, derived from primitive streak epiblast, disappears and forms nucleus pulposus more than apical ligaments of dens. So the midline mesoderm is called notochord, out of which you will get nucleus pulposus and ligament of dens. Next to it is called paraaxial mesoderm. Next to it is intermediate mesoderm, and then is the lateral mesoderm. Applied aspect. Persistent of notochord is called chordoma, congenital tumor. So you have heard that persistence of notochord is called chordoma, congenital tumor. Mesoderm, yolk sac, lateral mesoderm, intermediate mesoderm, paraaxial mesoderm. Here you have your notochord. This is the yolk sac, and then the lateral mesoderm, they have divided it into a cavity and side A and B. So the side towards the yolk sac, they have called it splenchno-pleuric layer, while the opposite side is called the somatic layer. So the lateral mesoderm, again they have divided into the cavity, and the wall towards the yolk sac is called splenchno-pleuric layer, and the wall opposite to that is the somatopleuric layer. The intermediate mesoderm, it forms urogenital system, which consists of kidneys, gonads, mesonephric duct, paramesonephric duct, etc. Paraaxial mesoderm. So the mesoderm next to notochord forms somites in craniocaudal sequence. It forms somites in craniocaudal sequence. The paraaxial mesoderm, they form somites. Somites, sequestrations of formation. So they are forming from cranial end towards caudal end. So first mesoderm is occipital, followed by cervical, then thoracic, then lumbar, then sacral and coccygeal. So occipital, cervical, thoracic, lumbar, sacral, coccygeal. Somatic period is 20th day to 35 day, 5th week. First pair is formed by 20th day, 3 pairs a day. So first pair of mesoderm is formed by 20th day, and here you have 25th to 35th day is the total formation period. For example, day 21 4 pairs, day 22 7 pairs, day 23 10 pairs, day 35 42 to 44 pairs. 35. So 3 pairs every day. The mesoderms are increasing by 3 pairs every day. Application: to predict day of development by counting number of somites. So you can count how many number of somites are there, and you can see which day of gestation it is. After 5th week, few occipital and coccygeal somites disappear and are reduced to 37 pair, remain constant. So after 5th week, 5 into 7 is 35, and here you have seen that the somatic period is between 20 to 35 days. So after 5th week, that is the 35th day, some of the somites disappear from the occipital and coccygeal end. So the very first and the very last, some of the somites are disappearing, and then the remaining are 37 pairs which remain constant. Subdivisions: lateral mesoderm, which had splenchno-pleuric layer and the other layer's name was somatic layer. Intermediate mesoderm, which is giving rise to somites. which gives rise to the genitorenal system. Paraxial mesoderm forms somites. Somites: sclerotome, myotome, dermatome. Sclerotome. So the somites are again divided as sclerotome, myotome, and dermatome. Here you have seen S is for sclerotome, M is for myotome, and D is for dermatome. So sclerotome forms axial skeleton, vertebra, surrounds neural tube and notochord. Myotome forms skeletal muscles, and dermatome forms dermal layer of skin. So sclerotome will form the axial skeleton, which is your vertebra, and hence it will surround the notochord and neural tube, while myotome will form skeletal muscles and dermatome will form dermal layers of skin. Myotome has occipital somites, preoccipital somites, and cervical somites. So occipital somites will form tongue muscles, preoccipital somites will form extraocular muscles, cervical somites will form diaphragm, phrenic nerve 3, 4 and 5. Phrenic nerve 3, 4 and 5. So important to remember, occipital somites form tongue muscles, preoccipital somites form extraocular muscles, and cervical somites form diaphragm and phrenic nerve. Diaphragm, and it's supplied by phrenic nerve C3, 4 and 5. Lateral mesoderm cavity forms body cavities, precardial, pleural, and peritoneal. Divided by cavity into splenopleural layer, which is the cardiogenic layer, and somatic layer. So splenopleural layer, which they have also called cardiogenic layer, forms splenopleural layer of body cavities, cardiac muscle and smooth muscle, heart tube. So it forms splenopleural layer of body cavities, cardiac muscles, smooth muscles, and heart tube. Somatic layer causes somatic layer of body cavities, appendicular skeleton, upper limb, lower limb bones. Axial skeleton was coming from the sclerotome part of paraxial mesoderm, while the appendicular skeleton is coming from the somatic layer of lateral mesoderm. Note: heartbeat starts by 21st day. Cardiac activity visible on ultrasound by 6th to 7th of week. So heartbeat is starting by 21st day. 21st is your 3 weeks, but on ultrasound you will be able to see it by 6th to 7th week. So heart activity starts by 21st day. On ultrasound you will be able to see it by 6 to 7 weeks. It is almost after a month. Development of placenta develops from both maternal and fetal contribution. Chorion. This is your amnion, this is your yolk sac, this is the epiplast, this is the hypoplast. Number 1 is the extra-embryonic mesoderm. Number 2 is the cytotrophoblast. Number 3 is the syncytotrophoblast plus blood vessel. Cytotrophoblast and syncytotrophoblast is primary chorionic villus, along with extra-embryonic mesoderm, secondary chorionic villus, and with the blood vessels, tertiary chorionic villus. Chorionic villi. Finger-like projections, fetal contribution of placenta. Fetal contribution of placenta is called chorionic villi. Maternal blood vessels, vascular lacunae, chorion, cytotopoblast, extraembryonic mesoderm, primary chorionic villus. This is the primary. Secondary chorionic villus has maternal blood cells, and then tertiary chorionic villus has villus chorion, fetal contribution.